everyone, it's your girl Sophia, your host with the most. You know where we are, it's Corner Spot, where you meet with real talk, real love, and real people. You know I am your go-to host for all things dating and relationship. Today, on this episode, we have a very interesting, juicy, tantalizing topic. So guys, you guys want to stay right here without going anywhere. Yes, so today we are going to be talking about sexual disorder. You know, it's a very important part of any relationship. It is a very crucial part. This said topic has been what has ruined some relationship, in fact, to tell you how serious it is. So let's get straight into it. So first up, let's get the definition. I know you've been hearing of it, sexual disorder. What exactly does it mean? What exactly does it mean when you hear the word sexual disorder? So quickly, it says here, sexual disorders are conditions that affect an individual's ability to experience or engage in sexual activities in a way that is satisfying and healthy. So you know how I usually do it. When you hear a definition, there are keywords to it. The keywords actually makes up the definition, not the other way around. So if it says here that in a way that is satisfying and healthy, it means two things. It's supposed to be satisfying, one, and then it's supposed to be healthy. So if it's anything short of these two things, meaning it is already a disorder, it is an anomaly, it is not going the normal way it should go. So that is what they're trying to say here. And they can involve problems with what? Sexual desires, arousal, or orgasm, and can affect individual of any gender. So this is not a one gender thing that, oh, it's only that gender that gets affected with things like this. No, that's not it. Both the female gender and the male gender can be affected with this particular said disorder or disease, if you can call it. I think we can call it that, of course. Anything that is not in the right order, it's definitely a problem to your health already. It is a disease, it is a disorder. So yeah, we have an inexhaustive list of these disorders. You know, it ranges from several things. It is caused by several things. Some of it is actually a traumatic response, you know, perhaps for people that have had bad experiences with this before. It's a traumatic response that get them to react that way. For some people, it's health conditions that actually causes this. For some people, it's psychological problem or physiological problem. So whichever it is, I believe there are treatments for each and every disorder. You know, it's either you take, you know, the medical treatment, or you visit a therapist, you know, and they start, you know, counseling you and telling you what to do and how to go about it. So it is not the end of the world. It is not a thing that, oh, if you find out you have a particular disorder now, it's the end of the world. Nothing can be done about it. Some of these conditions can be managed. I feel even most of it can be managed. So it is not the end of the world. So if you find out that you or your partner has one sexual disorder or another, it is not a cause to, you know, ruin the relationship or break it up. People can actually work towards, you know, fixing that person with the disorder. You can see a medical personnel because they're in the right position to tell you what to do about the disorder and how to manage or contain it. So yeah, so let's dive straight into it. We have, like I said, an inexhaustive list. So the first sexual disorder we have here is called ED, letter E and D, which simply means erectile dysfunction. Erectile dysfunction. So what is erectile dysfunction? It says here it is difficulty in achieving or maintaining an erection sufficient for satisfactory sexual performance. Wow. So that's quite much, because of course, you know, without erection there can be no sex. That is just the way it is, especially for the male gender now. That is what aids them, that is what prompts them to be able to engage in sexual activities. So imagine your erection is not properly functioning, or you don't have the normal erection you're supposed to have. Of course, you won't be able to even engage in any sexual activity, not to talk of enjoying it. So it's a very big one. But like I said, it is not the end of the world, and of course there are treatments for these things. So if you notice your partner has this particular sexual disorder, you want to visit the hospital. The earlier the better. I believe there should be drugs, or things that can be used to contain this condition or to improve it. Perhaps they place you on a type of medication or a particular nutrition and tell you eat this particular thing or that thing, to help boost your blood. We all know I have a decent background in biology, so we know it's the pump and rush of blood to that region that makes it erect and all that. So you might want to increase or eat food substances that would increase your blood level, so it helps you when you're being aroused, for blood to be able to go down there and for you to use it to do what you want to use it for, so it's not the end of the world. So the second one we have here is premature ejaculation. This simply means ejaculation that occurs sooner than desired. So this is different from the first one. These people, it's not like they don't have erection. They do have erection, but they get to ejaculate too soon. Perhaps the whole thing is just getting started and your partner is just getting into the clouds and suddenly everything goes down, so it can be a problem. All of these things affect your sex life, which is a very important reason why you should take it serious and get it treated, because it gets to affect you, so I believe this condition can also be managed at the clinic, premature ejaculation, that is. So the third one we have here is delayed ejaculation. Wow. So for some people it comes too soon, for some people it's just delays, like it doesn't even come on time, so this simply means difficulty or inability to ejaculate during sexual activity despite adequate stimulation. So these people do not even ejaculate at all if we are to go with this definition, because it said it is what difficulty or inability to even ejaculate at all during sexual activity despite adequate stimulation. So the stimulation now is not the thing here. It is well stimulated, but it just cannot get to ejaculate. So I believe this condition can be treated, like I said. So no cause for alarm, don't be afraid, don't be scared. It can be treated. The fourth one we have here is anorgasmia. And what is anorgasmia? Anorgasmia is inability to achieve orgasm despite adequate sexual stimulation. Like I said, this disorder is not for just one gender alone. It doesn't just affect one gender. We have both the female gender affected by some of this disorder and both the male gender affected by some of this disorder, and we have the one that affects the both of them simultaneously. So this one is not just a male thing. This one is not just the type of disorder that only male have, or this one is not just the type of disorder that only female have. This one, both the male and the female can actually have this sexual disorder, So anorgasmia is inability to achieve orgasm despite adequate, sexual stimulation. You just cannot get to achieve that orgasm. You just cannot get to cloud nine. Yeah, cloud nine. So the next one we have here is hypoactive sexual desire disorder. HSDD. I'm going to take it again. Hypoactive sexual desire disorder. This one simply can be defined as what? Persistent or recurrent lack of sexual desire causing distress or interpersonal difficulties. Good, very good. Like what I said earlier, this one now is not just a male gender thing or a female gender thing. This can actually affect the both of them. based on the definition. So this one now can be because of traumatic response to a particular experience they had before time. Most people life's journey are different. They've experienced maybe one bad thing or the other, and that is a traumatic response to that thing. So HSDD, hypoactive sexual desire disorder. Yes, so I know you are learning as much as I am, because truth be told, some of, or most rather, of these things I haven't heard of before. So let's continue. The next one we have here is sexual aversion disorder. This is what intense aversion to an avoidance of sexual activity, which can cause what distress. Just imagine a person who the thought or the topic of sex turns off. I'm sure you don't want to be with that kind of partner, but like I said, this is not their own doing. It may be due to some traumatic experience they've had. Imagine a lady that was gang raped, for instance. Of course, it will be a normal response if she hears the topic of sex and she goes, ugh, or she's like, oh God, because of her experience that she has had. So, these things can be treated with the right therapy, with the right medication. You are good to go. Your body and your sexual health can function normally again. So that is that for sexual aversion disorder. These are people that have extreme aversion, extreme hate, extreme, withdrawal to anything that has to do with sex or that topic in general. So the next one we have here is genital pelvic pain or penetration disorder. So from the name now, you get to know this is the type that affects that affects the female gender, because of course who is getting penetrated? Of course, I didn't have to tell you all these things. So genital pelvic pain or penetration disorder, this simply can be defined as pain during intercourse or difficulty with penetration due to pain or fear. You have it already from the definition. So this person is scared, perhaps from their orientation that they've had about the topic of sex. So they are scared about it. Perhaps they see it as something very painful. This can be treated, with the right counseling. You get to meet a sex therapist, they put you through and tell you, hey, no, it's not like that, or it's like this and all that. So the next one we have here is vaginismus. Now we know vaginismus is something that has to do with the female, of course, because it's the female gender that has the vagina. So vaginismus is what? An involuntary contraction of the vaginal muscles that makes penetration painful or impossible. Wow, this is very, very interesting. It's very interesting for me to hear. It's an involuntary contraction of the vaginal muscles that makes penetration painful or impossible. Wow. Like, I'm still trying to digest it. Let me know if you've met someone that had this condition before. Please let me know in the comment section. I would love to hear your story. So just comment below, or if you've heard about it, because it's like my first time of hearing about this. So let me know your thoughts on this. The next one we have here is sexual dysfunction due to a general medical condition. If you remember what I said earlier, some of these things are caused by a particular health condition. So I think this is what this is trying to talk about, sexual dysfunction due to a general medical condition. So let's get on with the definition. It says sexual dysfunction that is directly caused by a medical condition like diabetes or cardiovascular diseases. So wow, this is actually much for me to take right now. I never knew diabetes can, impact or affect on your sexual life, or some cardiovascular diseases. If you knew beforehand or you're just finding out, please let me know in the comment section, comment below, because for me, I am just finding this out right now. So you see, medical condition like diabetes and cardiovascular disease can also impact or affect your sexual health, but I know it can be treated. The condition can be managed, like I said earlier. So the next one we have here is substance or medication induced sexual dysfunction. Wow. So these are dysfunctions or disorder that are caused from using substance That is why it is advisable to not blow things out of proportion. Say no to drug abuse. Say no to drug abuse. It comes in handy with this kind of conditions, because this one now, it's self-induced. Of course, it's not like your body system was not normally functioning, but due to the intake of some particular substance or medication, it affects your sexual performance or your sexual health. So this kind of disorder is self-induced from the use of substances or medication. But I believe it can also be treated, if you perhaps stop those medication. That is if it hasn't caused long-term effect already, but I believe the condition should be a manageable one. So the next one we have here is sexual addiction. Now this might look like a simple or a funny disorder, but it's actually a disorder, because everything is supposed to be done in the right proportion. The saying, too much of everything is bad. So the same goes for sex as well. So if you have a partner that is addicted to sex, you guys might want to go to the hospital. Don't just say, oh, it's normal, he has high libido or she has high libido, it's a person or it's his person. It is not his person, it is not a person, it is a sexual disorder. You can see from here. So you might want to have that checked out. So what is the definition here? Let's see it. It said sexual addiction is a compulsive engagement in sexual behavior despite negative consequences. You're just compelled to do it. You don't just have control over yourself. You don't have control over your desires, and oftentimes it leads to negative consequences. So that is what sexual addiction is. So the next one we have here is sexual compulsivity. This is repeated, frequent, and often risky sexual behavior driven by an uncontrollable urge. Wow. So this is actually like the elder brother of sexual addiction, because sexual addiction is just you being addicted to something. We can get addicted to different things, but it's still within our will. It's just like, I used to have a friend that is addicted to coke. Like, it takes coke every day, not in the right proportion, not even if you even say it's one bottle per day, that will be too much, as over time, because it's you consuming sugar from Sunday, Monday, Tuesday, Wednesday, Thursday, Friday, Saturday, like that, one bottle per day. But it is more than one bottle. It is not even 2 or 3 bottles of coke. It takes up to 5 bottles of coke daily. Guys, I'm not even capping, literally. So this person is addicted, but is it within his will to still stop it? Of course it is, because he willfully allowed himself to become addicted to that, and he can still control it and say, hey, I'm going to cut down on this. If it is not within your will, it won't be called addiction. It is called addiction because it is still within your will to stop it. But when we are talking about sexual compulsivity, now this one you are compelled to, you don't even know what is driving you. So this one now, it's above or beyond your will, because you are compelled to do it. So sexual compulsivity is repeated, frequent, and often risky sexual behavior driven by uncontrollable urge. This person just needs to go to therapy immediately. So, but I believe the condition can be managed. The condition can definitely be managed. The next one we have here is sexual desire disorder. This simply means what? Issues related to a decreased or absent sexual desire. I think we had one definition earlier that is almost similar to this one. I can't remember it. Okay, I think it's about sexual aversion. People that the thought of sex makes them irritated, due to some traumatic experience. So this is also a similar definition, because this is a person that he has decreased or it doesn't even, it's like second to none. It's like he has little or no desire at all for the topic of sex, or for anything that has to do with sex, anything that has to do or relates to sex. So the next one we have here is orgasmic disorder. Orgasmic disorder. Now, what is this orgasmic disorder about? This orgasmic disorder is difficulty or inability to achieve orgasm. Difficulty or inability to achieve orgasm. Like I said, this condition is for both male and female. This one is not just a one gender thing, you know. So the next one we have here is fetishistic disorder. This is the first time I'm hearing of this, I must confess. Fetishistic disorder. Now, what is fetishistic disorder? This is intense sexual arousal from non-living objects or specific non-genital body parts. Wow. This one is deep. Literally, it is intense. Intense meaning it is too much. It is passionate. It has a grip on the person's mind or on the way they act, you know. It is intense sexual arousal from non-living objects. Just imagine that. Take a moment to imagine that non-living objects actually get you aroused is a problem in the first place, you know, or specific non-genital body parts. So somebody can be aroused by the hand, because this is a non-genital body part. These are not my genitals, you know. Or you can be aroused by my nose. It's crazy, but it happens. If it doesn't, we wouldn't have it here as a sexual disorder. But I believe these conditions can be managed and treated, like I usually say. So fetishistic disorder is an intense sexual arousal from non-living objects or specific non-genital body parts. The next one we have here is exhibitionistic disorder. Exhibitionistic disorder. Now, what is this trying to say? This can simply be defined as recurrent and intense sexual arousal from exposing one's genital to unsuspecting individual. Get out! This is crazy. This is really crazy. So this people or this people that have this sort of disorder, they get aroused and they get intense, just like the first one. Yeah, arousal are always intense. I wonder why. They get intense arousal from exposing their own genitals, you know, their private parts now, to unsuspecting individuals. So like, it's like you're just standing at, you know, the park, or you're sitting, having lunch or having a good time, and one stranger is just somewhere opening his trouser and showing you his PP, you know. This is exhibitionistic sexual disorder. That guy is not normal. Sis, you know, it's a disorder and you want to move as far away as possible from that sort of person. Of course, except of course they are willing to get help, you know, because it is not a normal thing to do. That you making other people see you is what actually gets you aroused. Is a crazy idea to think of. So that is that for exhibitionistic sexual disorder. The next one we have here is voyeuristic disorder. Voyeuristic like voyagers. Voyeuristic disorder. Now, what is this voyeuristic disorder? This is also a recurrent and intense sexual arousal from observing unsuspecting individuals who are naked or engage in sexual activity. I believe if we flip this definition, we can say it's like people who enjoy watching porn, you know. It's almost similar, because this is you being aroused or getting satisfaction from seeing people who are naked or people who are actually doing the do. So you get aroused by that. Is a disorder. If you enjoy seeing naked ladies or naked guys and that turns you on, it is a disorder. This is a voyeuristic disorder. Or you enjoy seeing people who are engaged in sexual activities, it is a voyeuristic disorder. You want to get yourself checked out. So the next one we have here is pedophilic disorder. Pedophilic disorder, from the word pedophiles, you know. This is what sexual attraction to prepubescent children. I love how they define this. These are still little babies in fact, because prepubescent, they are not even up to the age of puberty, meaning they normally or naturally do not have any bodily features that should turn you on or that should make you aroused, but you are aroused and turned on by innocent children. This is a terrible disorder, and this one should actually be given extra attention, because that means children are not safe around you. Your niece, your nephews, your neighbors' kids and all that. So you want to check this out, pedophilic disorder. So the next one we have here is sexual masochism disorder. Sexual masochism disorder. What is this disorder? What does it entail? This is a recurrent or intense sexual arousal from being humiliated, beaten, bound, or otherwise made to suffer. This is giving the vibes of 50 Shades of Grey, right? Because I don't just understand how you get sexually gratified from suffering or from being made to suffer, from being beaten, humiliated, tied up, bound. Like, it's crazy. But hey, it does happen. If it doesn't, we won't find it here as a sexual disorder. Now the next one we have here is sexual sadism disorder. Sexual sadism disorder. This is what intense sexual arousal from suffering or humiliation of another person. Okay, I think it's like the opposite of sexual masochism disorder, because this one, they want it to be done to themselves. Like, you get gratified or aroused when somebody beats you or humiliates you or makes you to suffer, But this sexual sadism disorder, now it is when they're the one doing it to someone else that they get aroused. So this is crazy. Either ways, this is a no-no for me. I don't know about you. Let me know in the comment section. Would you love to try out that kind of sexual activity where you be beaten or bound or tied up, in a very discomforting way? Will it get you aroused, or will it get you satisfied? Or would you love to do it to somebody else? Will that help you get aroused or satisfied? Let me know in the comment section. So the next one we have here is transvestic disorder. Transvestic disorder. Now this transvestic disorder is intense sexual arousal from cross-dressing, which causes significant stress or impairments. So these people actually, they cross-dress, but they don't just cross-dress for the fun of it. They cross-dress because of their sexual desires. It makes them feel aroused, and that is it. Transvestic disorder. Another disorder we have here is the paraphilic disorder. Paraphilic disorder. This is a range of sexual disorder involving a typical interest that causes distress or impairment. So this one has to do with the said person's interest, but it causes distress. So that is what paraphilic disorder is. The next one we have here is sexual dysfunction post-trauma. Sexual dysfunction post-trauma. This is what sexual difficulty that arise following a traumatic experience. Exactly what I was trying to say earlier. Some of these disorders are not self-inflicted. Somebody would not just feel like, oh, this is how I'm going to act when it comes to the topic of sex. Something has to lead to something. So this sexual dysfunction post-trauma now is a difficulty that arises following a traumatic experience the person has had, such as sexual assault. Have you been a victim of rape? It is not funny. Or have you met a victim of rape? It can be lifelong damaging. The trauma, it takes the help of God to actually bounce back and function normally, or even start relating with the other gender the way you ought to. Trust me, it is not a funny experience. So people that have this sexual disorder now, this post-trauma sexual dysfunction, they ought to be treated with extra care, because it is not their own doing. It is something that they experience. that made them start acting that way, so I believe this can be treated, the condition can be managed with therapy, good therapy. Yeah, we'll get you through it. The next one we have here is body dysmorphic disorder. Body dysmorphic disorder. In bracket, it says sexual aspects. So this can be defined as preoccupation with perceived defects or flaws in one's sexual organs, impacting on your sexual functioning. So if you have a person, or if you've seen, or if you met a person who feels there is a particular flaw or the other, in relation to their genitals, this person has body dysmorphic disorder. They just feel, oh, the shape of my genital is not the way it ought to be, or there's something wrong somewhere. This is not a normal condition. It's body dysmorphic sexual disorder, and you want to get this person to the doctor as soon as possible. Then we have sexual communication issues. This is problems in communicating sexual needs or desire, affecting sexual satisfaction. It is also a disorder, when there is communication issues when it comes to the issue or the matter of sex. And there you have it today, guys. Let me know if you've learned anything new today, and if there is any other disorder that you feel I should mention that I didn't mention, or if there's any other disorder that you know or you've experienced, please kindly leave a comment in the comment section. Like, share, and subscribe. This is Corner Sports, and I am Sophia, your host with the most. Bye.